Hi, everybody. Dr. Misty here. Thank you for joining in today. We're going to talk on Wellness Wednesday about how stress presents in the body, how your body might be communicating to you that you've been stressed for a while, and how it is manifesting in your body. This is so common, and this is not just coming from literature and my educational background. It is coming from 10 years of practice as also a chiropractic physician. So I am a functional medicine practitioner. I am also a chiropractic physician as well as a clinical nutritionist. And prior to that, I was a kinesiologist. So a lot of my education, I've spent way too many years in a book, essentially. And I love reading. But anyway, what that does is it gives me a lot of information as well as experience to help you understand what I've seen in practice and what correlates from people who are stressed. Now, this is a time of year specifically for trauma survivors or people of developmental trauma. It's very stressful. It can bring up a lot of unearthed hurts. It can bring up just a lot of stress, a lot of anxiety, and on top of the regular holiday hustle and bustle, especially during a time of the difficult times with quarantining and everything, especially if you live in areas where it's colder months coming. This is a very big time for anxiety and seasonal depression because of the lack of sunlight, things like that. So we're adding layers and layers on top of layers of stress, right? So here are some tips that your body might be presenting with stress. Headaches, tension headaches. You're somebody who has chronic tension headaches. If you have headaches along the base of your skull, back here, if you have headaches going up one side and around your eye, specifically if it's one sided or both sides, if this is a chronic type of thing, headaches is a huge, huge, huge indicator that stress is you have too much stress going on. Part of that is because when we are stressed, we kind of recoil a little bit. Now, especially being that we are in a time of sitting at computers and everything that we're doing, working, um, even virtual meetups and things like that is on a computer, right? So we're in this posture all the time. So it's really important to understand that when we're consistently in this posture, especially if you're not somebody who is used to sitting down, um, and then adding the stress on top of it, what happens is your body in a fight or flight state, your body physiology changes and you're actually can morph into, like, if you've ever seen anybody, this is like a big indicator of that, like, somebody's a trauma survivor, is they have a posture where their shoulders are kind of like being brought forward and they're in this like protection mode. So their shoulders are coming in, they're sitting forward, they're in a protective kind of cocoony type of posture versus an upright, um, you know, tall type of posture. What that does is it actually sets off contracture of what's called your trap muscles, which are one of the major neck muscles. You have many layers of neck musculature. The head and neck musculature is some of the most complicated um, and layered structures. So it's imperative to understand that if you are getting a headache, it doesn't necessarily mean you're dehydrated or like something is wrong. That is a key sign that your musculature and your spine might need attending to because you're getting what's called a psychosomatic reflex. Okay. Your body actually has different types of reflexes um, you that can happen as your body is presenting a problem. So you can have a psychosomatic reflex, you can have a somatic reflex, or a visceral somatic. Okay. Essentially a viscerosomatic reflex is something like you have cancer or something that's presenting as body pain. That's like worst case scenario. Another would be something like a heart attack and somebody's getting jaw and arm pain. So they're getting a viscerosomatic reflex. They're getting pain that originates in your organs, right? But it presents in your somatic system, your muscular system. Okay. There's other pain that's called somatic, which is essentially like you have a referral pain from the specific tissue of the body, joint pain, things like that. The pain spreads out from the joint. Psychosomatic is something that literally is pain caused by um, psychological stress or dysfunction. So this is something that is very big with stress. The most common psychosomatic is stress, pain in your shoulders and headaches. Huge psychosomatic reflex. So if you are somebody who's feeling like lately you're like, geez, like I've been super stressed out and all of a sudden I'm getting this like major behind the eye headache. It's just constant. You might need to be examined in your upper cervical spine. And B, you probably have a bunch of trigger points, which are like tight muscle tissue, that is referring to areas on the front of your face or your head. Okay. That happens from chronic tightness. Why are you getting chronic tightness? Because your brain is constantly stressed out and you're doing this, right? And you might not even know it. And so your body is contracting that muscle all the time. You're constantly in this position. This muscle is engaged and you're getting that contracture. If this contracts enough, it's going to create those problems. It's going to create those trigger points that create headache pain. Okay. So, numero uno, sign and symptom, chronic stress in the body is headaches. Okay. Headaches, neck pain, especially for women. Believe it or not, in men, what I've seen more is actually low back pain and mid back pain. So it was very interesting to see that men don't carry as much of that. They carry stress in different areas. So sometimes low back pain can be presented as well. Okay. Systemic body pain. So if you are somebody who has kind of unexplained type of symptoms, so you have numbness, tingling, you have traveling pain, right? So you might have pain here one day, here another, things like that. That could be, and it's very widespread. That could be an indication of fibromyalgia, which absolutely happens in trauma survivors and absolutely gets worse with stress. Okay, so big, big, big indicator that something might going on there. Another thing is that if you have chronic areas of pain, say you're like, oh, I was like in a car accident 20 years ago and I've had low back pain forever. And I've just noticed like lately my pain is getting worse and worse and worse. So somebody's turning up the amplifier on your pain, right? That's another indicator. The other one would actually be fatigue. So just exhaustion, systemic fatigue. So can be confusing, or depression. Okay. Depression sometimes, especially, this is going to be confusing, especially around this time of year. Um, what happens with depression is not just from a psychosomatic or a psychological aspect. Our body and our brain use neurotransmitters and chemistry and signaling to have our brain functioning. Okay. So when you are out of balance, you hear a lot of doctors say, well, you just have a neurological imbalance, right? Um, there's typically more to it than that. There is usually multiple layers from what I have seen. Typically, people who present with depression also have a major gut issue because a lot of their neurotransmitters are actually precursors are formulated in the gut in the GI tract. Okay, so if you have an unhealthy gut, your gut brain connection is absolutely going to show up as, brain fog, exhaustion, and if you're a chronic stress or trauma survivor, more than likely you have PTSD, or complex PTSD. But really, on top of that, there can be just such a variety of symptoms, right? So what stress does is it absolutely will wreak havoc on your GI tract, as well as increase inflammation levels, but it will also amplify those types of symptoms. Okay, so depression doesn't always just mean you have a neurochemical imbalance. Okay, um, sometimes, you might be somebody who's tried different medications and such. Um, Sometimes it is really a combination of genetic with trauma with underlying issues. So, like stress is going to cause, again, wreak havoc on your gut, wreak havoc on your adrenals, wreak havoc on inflammation levels, right? If you have a lot of gut issues, you're going to have a lot of absorption issues typically, right? You're not going to absorb a lot of vitamins. You're not going to absorb a lot of your nutrients that you need. And so the other caveat to that is that, why are you getting? I always like to ask, why are you getting a neurological imbalance? Like, yeah, you might be very low in serotonin. My question is why, right? Well, your gut's not producing as much as it should. Maybe your uptake is too high. Some of the neurotransmitters get actually they get they're so like a nerve synapse looks like this. At one level, some of the neurotransmitters come here, they cross this little bridge gap, and then they cross into the other synapse. So essentially, sometimes you can get symptoms when there's too many of the certain neurotransmitters in between and not being enough taken up. Sometimes there's too little. Sometimes there's just not enough production. So there's a lot of things going on there. And there's a lot of different types of neurotransmitters. And we all have different genetics. Okay. So depending on what we're doing, how much stress we have, stress really turns on our disease genes. Okay. So that is going to show up more in a depression aspect. The other thing that you might notice is cravings. So you start craving um, more of certain things. So if your stress is higher, your adrenals are going to have more issues. You're going to start noticing more sugar and salt cravings. Okay, that's a big one, and sometimes people don't pick up on that as much, especially if you're getting like a 2 o'clock crash, things like that with fatigue. Now, the other part about fatigue is that it's not just an adrenal issue, sometimes it's an autoimmune issue. Okay. So chronic stress will absolutely, if you have autoimmune, it will plummet your actual immunity. Okay. And your ability to fight inflammation levels. So it's very important to understand like the levels of fatigue that you might be feeling with stress. If it's just like, oh my God, I just need another cup of coffee, like I kind of just feel like, ugh. Or is it full body, just like my body feels awful? Like I just feel swollen, I feel tight, I feel like, I just feel like, my body is lead, I can't move. Those are all indicators of your stress is too much as well, and something chronic is going on. Okay. So it's very important, and usually I talk about this, it's always, you know with chronic disease, it's not just what is it, what's the disease, it's why. Because chronic disease develops, and it doesn't develop overnight. Okay, that's why it's called chronic. Chronic means like a long period of time. Okay, an acute infection, say you got the virus, right? That's an acute issue. right? Your body can pick up that. You can get sick, you can get a stomach bug quickly, right? Your body with chronic disease works so much differently, and it works on a micro level, cellular damaging level over a long period of time, right? Similarly with like heart disease. Okay. So you start getting issues with, especially with stress. Unfortunately, with that kind of issue, you might not know that you're having an issue until you go to the doctor and know you have hypertension and or you have a heart attack, right? Because that's more of an insidious type of thing where you're getting plaques built up from all this the high stress. Um, and you don't know that that's happening until when something bad happens. Um, so those are just some ways that your body is telling you that you're under too much stress and you need to modulate better. Okay. So our bodies communicate with us all the time. We just have to be better listeners to understand what it is that they're trying to tell us, right? Sometimes even especially with fibromyalgia patients, you might notice if specific um, traumas. I really truly am a firm believer in this is that we hold as we swallow and forget certain traumas. Um, they really get like stored in our body. They really do. I had an experience once that was like really embarrassing actually. I remember back in chiropractic school and I had something that happened to me. It was before I knew I had PTSD, and I remember getting adjusted and getting like a shoulder adjustment. And they were just demonstrating on me. I was just kind of sitting there like, oh, okay. And then all of a sudden they did the adjustment and I felt searing pain. And all of a sudden I started just like tearing up for no reason. Like I just had no idea what was going on. I was like, I don't, what is happening? And there was nothing, like, I didn't have an injury to my shoulder or anything, um, and over the years, like, I've remembered certain things that attribute, traumatic and abuse-wise to my shoulder, and what had happened was that triggered, kind of a flashback for me, a somatic flashback where I didn't have a concrete memory, but my body remembered, So powerful. The body is such an amazing, it's so amazing. It really is. If that sounds similar to anything that you've gone through, by the way, a great book to help you is called The Body Keeps the Score. That is something that is really helpful if you're just somebody who's newer to discovering they might have trauma or chronic trauma. You might have some memories coming up, or you might be in a growth process and trying to heal yourself, and you're noticing certain patterns or relationships, or you had a really intense abusive previous relationships. Some people who are married to people with NPD, like narcissistic personality disorder, or other types of disorders, who are highly emotionally or physically abusive, will end up in a situation where they can develop like chronic fatigue and fibromyalgia. And so stress can change their brain state as well, right? So they're easier when that happens to you, you're easier in a state of hyperarousal and stress. So that's why it's very important for trauma survivors to understand and listen to their body and trust themselves. That's such a process that I 100% get. Um, but just to be open to understanding how your stress is manifesting and can manifest in your body and create some symptoms. Okay. So things that you can do if you notice that you are having a lot of these symptoms. If you have gone to another practitioner before, if you've never been to somebody who's a chiropractor or an osteopath, I would highly recommend that. Um, Also, one thing you can do is you can contact me for a virtual consult. to get more information. So what I end up doing with patients is, and it's really powerful because these are just tests and things that other, like the traditional medical model, um, their good medical practice does not practice this way. There's different thoughts. There's different ways of looking at the body and health. And so what I like to do is not just run lab works for patients, but really delve into functional labs, right? And so I had recently just had somebody who's under a major amount of stress, is um, helping with some of the I think the marketing aspect of the election, which I'm like, wow, that I can't even imagine how stressful that is right now. Um, and through functional tests, this is somebody who's had an issue for 20 years, wicked stressed out, um, numbing with alcohol, um, super there's like, headaches, things like that. I was able to help this person figure out. They've been to numerous practitioners. They've had upper GIs, lower GIs. They've been to an array of physicians. What we were able to find out when we weren't just chasing a diagnosis, but really looking at the function of the body, the absorption of nutrients and vitamins, what was going on specifically in her gut was we were able to, put her we worked together to get her better, right? And her symptoms, this is somebody who is having such trouble, like that was barely able to go out or travel far because of the issue with using a restroom so often, right? On top of stress, we all know that stress can also manifest as like IBS, right? So if you already have like a gut issue, and particularly more on the IBS side, that can make stress way worse, right? I was able to do functional labs with her and get her symptoms almost 90% gone within 30 days. I'm so proud of her, and a lot of it isn't necessarily right now. She's like, a lot of her brain fog has gone down. Her drinking, she's not drinking, things like that. So for trauma survivors, it's not, sometimes we always like to link everything back to the trauma, or like we want to link stuff back to one diagnosis, but it's different than that. It could be that those symptoms are worse because of other areas in the body that need work. um, so if that is you and you feel like you would like more help in this area and somebody to do a little bit more detective work, I do virtual health consultations and functional medicine consultations. And you can find that page at www.newhorizonchiro.com. And you can check out the appointment page from there. You can book right online. And if you have any other questions, you can also comment or message me, and I'd be happy to help you out. Otherwise, I hope you found that this video very validating and informative. I know during the next, couple months coming up are just super stressful. So please listen to your body. Please take care of yourself. Your health comes first. Try to let go. If there's any part of this video that I can give you as advice, try to let go of perfectionism, and not stay in a survival state. Try to get into more of a living state. Okay. And whether that be grounding, nature, anything like that, to help you. Okay. So I'm Dr. Missy Kosciuszko. Thank you so much for joining me again on Wellness Wednesday this week, and I will see you guys next week. Bye bye.